To be a navigator, we need to learn about a ship's structure and how to interpret a compass to ensure the safety of the passenger's voyage. Likewise, understanding about clients or patients as individuals is one of the requirements from nursing care. Each patient is a unique individual. They have their own past and present, beliefs and values, mindset, and professional expertise. Nursing care is the holistic aspect and is engaged in a variety of practices, such as respecting patients' decisions, identifying their needs, and showing sympathy while they are facing health-related issues or social problems. In order to provide high-quality care to patients and improve constantly for a better healthcare system, a person-centered care approach should be applied to achieve the positive healthcare's goals. A key principle of person-centered care is being able to work with patient beliefs and values. Beliefs and values are an essential part of how individuals see themselves and are instilled with personal meaning and significance. Nurses must perceive and treat each patient as individuals in order to successfully coincide with beliefs and values. Beliefs and values are shaped through life history and can later direct choices made. Medical and personal history provides nurses with enhanced understanding of behavioral and cultural differences between each patient. A greater understanding of different beliefs and values allow nurses to tailor person-centered care specific to each patient. Learning about beliefs and values can also be challenging. Respectful and trusting relationships are built upon understanding patient beliefs and values. Nurses must be sensitive to patient values and beliefs and be careful when responding under stressful clinical situations. For example, it would be poor practice to confuse an old frail patient as sick or handicapped, or address new patients by their first name. Skewed patient impressions can lead to false diagnosis, elementary observations, and practices that are not person-centered. To avoid false prejudices, it is important that nurses continually update and adhere to new patient information and practice specific person-centered processes and data gathering techniques. A case study describing the challenges nurses may face regarding patient beliefs and values can be found in the textbook Nursing Care for Older People. The real-life example describes a 7-year-old male named Mr. Oliver, admitted to hospital due to chest infection. Mr. Oliver works on a farm and has woken up at 5 a.m. sharp every morning for 40 years. Mr. Oliver's ward has a light off rule until 7 a.m. After waking up in his ward at 5 a.m., Mr. Oliver rings patient bell and asks for a cup of tea. The nurse abruptly replies it is too early and that he should go back to sleep. This demonstrates the inability some nurses have in gaining a firm understanding of values and beliefs. Too often, nursing staff prioritize routines of the hospital facilities rather than the patient's values and beliefs. A better way to address the situation would be to escort Mr. Oliver to an area of the ward where he could have his cup of tea without disturbing neighboring patients. It is essential to gain a thorough understanding of Mr. Oliver's lifestyle norms in order to deliver care that is therapeutic and person-centered. Shared decision-making can be defined as a method where the patient or clients are involved in the decision-making process, which therefore includes taking into consideration the patient or client's preferences, showing respect for their choices, and providing realistic, informed options. This concept also includes working with the patient or client's beliefs and religious values and creating a realistic baseline for the decision-making process. Person-centered decision-making can be described as the center of the knowledge and experience an individual can apply to the care process, which can assist in the treatment process. It aims to change past experiences and therefore allow them to reflect on the various perspectives, which can then assist in forming perceptions and understandings. For the health practitioner, it is crucial that they are there offering support and practical knowledge while allowing the patient or client to be following their own path. Therefore, one of the most important aspects of this framework is successful methods of communication, which includes active listening. There are various challenges that can be present when applying the shared decision-making concept, and they include ability to understand medical information, family dynamics, cultural and religious differences, language barriers, lack of time with health professionals, and also not being able to come to an agreement with a health professional. However, from research, it has been noted that the biggest challenge with the shared decision-making method is the inability of the patients to feel confident enough to participate or choose an option, as well as finding difficulty showing their preferences. It was shown that many of the patients or clients found themselves forming a barrier between the health practitioner and themselves in terms of medical knowledge. In a research study carried out by the Health Foundation, it was illustrated that patients or clients felt that they do not have the sufficient knowledge and would just like to be told in what to do about the treatment. As mentioned before, communication is a vital key in the shared decision-making framework. And without the communication and participation from the patients or clients, it would not successfully fulfill the attributes of this concept. Like the example on the slide, it says, I have had people say to me things like, I take my car for an MOT and the mechanic tells me what's wrong with it and I pay for it and sort it. That's why I've come here. I just want you to tell me what to do. Although this is not a direct medical example, it perfectly explains the patient's perspective. And also, many health professionals have heard similar phrases like this from patients.
Authentically is the connectedness of the practitioner with the patient and others significant to them, determined by the knowledge of the person, clarity of the beliefs and values, knowledge of self and professional expertise. This definition was provided by Brennan McCormack and Tanya McCants in their text, Person-Centered Nursing, Theory and Practice 2010. The effectiveness of the practitioner to engage with and connect with the patient depends on the practitioner's abilities such as the patient knowledge, clarity of their beliefs and values, knowledge of self and professional expertise. In McCormack's publication, he presents 3 different levels of engagement. Full engagement is present when a patient and a nurse are connected in a relationship that has Full engagement is present when a patient and nurse are connected in a relationship that has care, partnership, and collaboration. Decision-making and values are known at an unconscious level in giving and receiving care, and the nurse is aware of the political, environmental, and cultural pressures and integrates them into their practice. Partial engagement is when the nurse assesses the situation but formulates a problem that causes the interconnected working between the patient and the nurse to be disrupted. This causes the relationship to be altered and the nurse may lose the grasp they had on the patient. During this period of time, complete disengagement occurs where the nurse needs to decide the appropriate action to reconnect the relationship, then work with the patient to achieve the most satisfactory resolution. A skilled practitioner will be able to adopt these 3 different stages at different times with the patient and move between them as well in order to get a clear picture of the situation and patient values. In McCormack's publication, he presents 3 different levels of engagement. Full engagement is Sadly, the emotional labour of nursing isn't seen as important as the real work or more clinical side of nursing. However, the importance of the emotional labour to well-being and person-centred care must be recognised and acknowledged. In a study of how patients experience person-centred care, one patient was going through chemotherapy and reported how comforting and encouraging the nurses were, even though they had never met before. There was a time she was feeling scared and once was crying in the hall and a nurse walked right up to her and embraced her. She didn't need to do that, she could have just walked on, Jenny said. This study showed that person-centered care is being experienced in some cases, and that nurses need to prioritise connectedness and compassionate care in conjunction with clinical competence. Being sympathetically present shows the understanding and accepting of personal uniqueness and values as an individual to indicate the status of the relationship in between the client and the health practitioner. Sympathy is not equal to empathy. It is classified sympathetic care is different from empathy since we cannot completely understand the other's particular experience. Bereavement is a notable instance. We cannot fully understand how a person feels after bereavement. Person-centered care is not only interacting with a patient. This can deliver when health professionals are providing all kinds of clinical interventions on a patient, such as administering medication and recording vital signs. These strategies to ensure sympathy are presenting in the clinical practice. Firstly, understand the values and beliefs of the patient as well as their loved ones by being active listening, non-judgmental and open and honest, collaborative and supportive. Then engage patient to make decisions based on their values and beliefs and reminding non-judgmental to their decisions. Don't forget, consider every moment spending time and working on the patient is potential opportunity to provide person-centeredness. Emotional management is a way to establish sympathetic care to the patient as well as their loved ones into the nursing practice. There is including superficial engagement, reflective engagement, and authentic engagement. Christ describes providing superficial engagement as changing different faces in front of different patients. Superficial engagement is demonstrating the professional duty into the practice instead of considering their personhood. Based on the quotation, Christ uses a way of reflecting experiences of herself and her loved ones to the understanding the feeling of the patient with cancer. Reflecting engagement leads health professionals to produce mirror emotions from their own or their loved ones' past experiences in relation to the client's condition. As mentioned, this cannot understand someone's feelings fully, as everyone is individual. Additionally, health practitioners may be over-implementing their personal emotions and beliefs based on their experiences in the past. Jenkins indicates her emotions to provide sympathetic care to the patient by analysing her personal values and beliefs. She manages to maintain professional and personal empathy into her practice that benefits her on building a therapeutic relationship with the patient. Authentic engagement requires health professionals to understand and express their perspectives in regards to the patient's condition and recognize the professional role. Health professionals have to be aware without suffering from patient's condition and look after themselves. Health professionals should seek for support to manage their emotions when necessary, for example, counseling consultations. Wisnowski mentioned an incident that a family were informed they would lose their loved one by a practitioner. This is a notable instance revealing the challenge of providing sympathy under the circumstance in the clinical environment. When the practitioner does not give any sympathy, the person may become more distressed and isolated. When the practitioner responds something like, you may have my sympathies. When the practitioner responds something like, you have my sympathies, this will not contribute to nothing. However, if the practitioner tells a lie due to compassion, the consequence is more likely to be worse rather than beneficial, since bereavement is going to be an inevitable fact. According to Tanya McCants, holistic care is the provision of treatment and care that pays attention to the whole person through the integration of physiological, psychological, sociocultural, developmental, and spiritual dimensions of persons. The aim of holistic assessment is to gain the most information necessary without finding irrelevant information. A person may present to a nurse with similar medical or social problems, but only by conducting a thorough and systematic assessment, including the factors mentioned above, as a truly individualized plan of care to be developed. The key to providing holistic nursing care is not about how long you spend with a patient, but how you use that time you had with them. Learn the patient's name and use it. Make strong eye contact. Show that you care. Preserve their dignity. Educate in the importance of self-care, and simply asking if the patients have specific cultural or religious requirements or benefits, and accepting these into the plan of care are all ways of promoting a healthy psychological, emotional, and spiritual environment, a holistic care environment. It is of common acceptance that regardless of the other person's centered processes that are also mentioned, routine technical and physical aspects of care achieve important aspects of holistic. Routine technical and physical aspects of care achieve important aspects of holistic care. One of the challenges relating to this is that the health practitioners need to pay attention to the whole person so they can deliver an overall therapeutic benefit. Challenges also include technical advancements, economic austerity, and public and media scrutiny. With illness and disease management becoming increasingly complex and higher patient caseloads, the reality is that it is simply easier to treat and care for the physical being of the patient and move on, without attending to the other holistic care needs, which is unsatisfactory for both the nursing staff and patients.
Patient-centered care is the approach that is used in the healthcare system with the engagement of not only healthcare professionals but also patients themselves with the purpose for the optimal health outcomes as an active partner. It is expected that patients will then obtain the capability to manage their health more effectively and give a basic understanding about their personal health issues. It brings benefits in many aspects, such as patient self-efficiency in recognizing the events happen relating to their health problems is built and promoted. Disease management will then be in patient's control. The communication between healthcare professionals, the doctors, nurses, social workers, physiotherapists, and patients can also be developed, and it can help establish a better relationship. All of these factors can contribute to achieve the treatment goals by participants. To prove for this valuable process, there was a statistical analysis which indicated the effective result after having applied patient-centered care processes in Gothenburg, Sweden, on 177 patients admitted to coronary care units for acute coronary syndrome, with other participants including physicians, cardiologists, and registered nurses. These comparisons were divided into two groups, control group and person-centered care intervention group, and proceeded in 6 months. Patients were shared with all medical referrals, care plans, and discharge notes by collaborative healthcare professionals. In the meanwhile, patients would be proactive in identifying all their symptoms. The control group's participants were managed by using guideline-based care procedures. The gap between follow-up visits were far, about 2 to 3 weeks after patients being discharged and another visit after 8 to 10 weeks when patients' health status were medically stable. However, all medical referrals and discharge plans were not shared with patients. Whereas in the person-centered care group, all participants were encouraged to actively take part in to achieve the optimal goals. Furthermore, after having been discharged to home, patients would be arranged for 2 follow-up visits by a cardiologist and the RN after the first 4-week discharge, then by a physician and an RN in another 4 weeks. Each follow-up visit included a discussion and revise session in the second visit about a PCC plan. The result proved that the patients underwent PCC group gained confidence in controlling their symptoms in contrast to whom in the control group regarding the improvements in lifestyle behaviours, self-management in the physical activity and stress, and the quality of life had been improved then. Person-centered framework is not only an unrealistic theory which the person-centered practice is really happening in the real world and applied in many healthcare centres, especially for the dementia patients. Dementia can cause people forgetful, limited in social skills, personality changes, and sometimes affected to their verbal communication. Based on those dementia symptoms, health practitioners should establish a unique care plan practice to satisfy different patients' needs, which person-centered care practice can be helpful during the care process. According to Yem, person-centered care practice helps the patients with dementia to have more choice and control in their lives. That means that person-centered care practice can support the people with dementia to live well by a series of personalization. To provide the best and appropriate care for different dementia patients, one-page profile and communication charts are really helpful in the care process. Those can help health practitioners to notice different needs in the situation of each patient easily. Sanderson, Bailey, Martin and Bennett 2014 stated that one-page profiles are the foundation of personalization, can lead to positive change for people, and it can help the practitioners know about each patient's background in a second. A one-page profile will capture all the important information about the person, such as what people appreciate about me, what's important to me, and how to best support me. The one-page profile can help health practitioners to build a better relationship with the dementia patients by truly understanding what really matters to the person in their life and the way to support to live it. Most important, it can help the health practitioners to establish a thoughtful healthcare plan which is suitable for the patients. Besides of one-page profiles, communication charts are another helpful tool, especially for the patients that have difficult for verbal communication and forgetful, in which can help their health practitioners to understand what a patient is trying to do, trying to explain, and helps them to understand them. Sanderson, Bailey, and Hughes 2013 stated that there are two communication charts in which is how I communicate with you and how we communicate with you that can help practitioners to understand how people tell us what they want and how they make decisions. Communication charts can be in different forms depending on which is the most suitable for the users. The best form of a communication chart is one which has pictures with text so that health practitioners can understand clearly for what the patient needs and wants easily. Patient-centered care is a useful approach and a highly demanding of the collaboration between healthcare professionals and patients for being able to achieve the optimal health outcomes. Healthcare workers, especially nurses, accept patient health problems as well as apply person-centered care processes as a tool to identify patients-related social and psychological aspects in a one way or another which can affect their health outcomes by recognizing individuals' values and beliefs, sharing their compassion and sympathy, respecting their decision-making, educating and interpreting their health concerns, and assisting them to be more independently on taking care for themselves. Effective communication between patients and caregivers helps develop a better relationship. It helps the professionals to educate and interpret patients' health issues and give solutions for them to be more independently on taking care of themselves. Consequently, patients will be proactive in identifying diseases, symptoms, and effectual conveying their concerns towards physicians and nurses. Early detections of symptoms will minimize the risk of complications.